a moment or two to allow other participants to enter. So we'll just wait another moment or two and allow others to join us, and then we'll get started. There's still people joining. Welcome those who are coming in. We'll get started in just a moment. Okay, so welcome everyone to this session on universal access to safely managed sanitation. I'm Juliette Willits. I'm a professor and research director at the University of Technology in Sydney, and we warmly welcome you to this session. So unfortunately, we're alarmingly off track in terms of sanitation, and it's estimated that we need to increase our efforts by 4 times if we want to reach the 2030 targets. And safely managed sanitation sets a higher ambition than open defecation-free communities or basic sanitation, but it's an absolute imperative if we're to protect public health and the environment. So this session aims to showcase actions that can help us accelerate progress towards universal access to safely managed sanitation. And the session is being convened by UNICEF, by the United Nations Human Settlements Programme, by the University of Technology, Sydney, by the World Bank Group, the World Health Organization, and LICSAL. And we hope that by the end of this session, across this group of participants, that we've increased a consensus about the need to accelerate progress on universal access to services, particularly in the face of climate change. And if we are to accelerate, then a critical question is also about what things might we stop doing so that we can best focus our attention and our energies where they're best, where they will serve us best. Secondly, we hope that participants will leave with a better understanding of some different programming approaches and innovative pathways that could support targets to SDG 6.2 in both rural and urban areas. And we're also hoping to stimulate ideas on how additional partnerships could be developed to promote safely managed sanitation. The speakers for this session have been carefully selected, and they can comprise senior government officials, representatives of development partners, and of the private sector. And before we move further into the program, I just want to let you know of a few housekeeping issues. If you could please pose your questions to our speakers and your comments on the Pathable interface, not on Zoom, and then we will be able to try to address those on the way through the session. And then in terms of a session outline, we will be having some opening remarks from Engineer Suleiman Adamu, Honourable Minister for Water Resources in Nigeria. That will be followed by a technical presentation on mobilizing actions for accelerating universal access to safely managed sanitation by Anne Thomas, Senior Advisor in WASH, UNICEF New York. We'll then have a short time for Q&A with our 2 presenters before moving on to a panel. And the panel is talking about working at scale to accelerate progress on safely managed sanitation. And they'll be sharing approaches, case studies, and their experiences. And we'll also have time with our panel for brief Q&A. And lastly, we'll have a summary and a wrap up from Kate Medlicott from the World Health Organization. So now Moving on to our program, I'd like to introduce to you the Honourable Minister of Water Resources for Nigeria, Engineer Suleiman Adamu. He's held this role from 2015 until now, with extensive experience on public and private sectors of Nigeria's development. And as the Minister of Water Resources, he's someone who has supported many initiatives to accelerate progress on SDG 6.2. Since 2017, he championed a national open defecation free, or ODF, campaign, and he has been the leading promoter and architect of the ODF Nigeria roadmap and the presidential executive order, which gives legal and top-level political backing to the ODF campaign in the country. So, Honourable Minister, the floor is yours to present your opening remarks. Thank you.
Can you hear me?
Yeah, now we can hear you. Yes.
Oh, okay.
Thank you.
Thank you, Juliet, and thank you. Good day to all participants, wherever you may be around the globe. I'm honored to deliver the opening remarks at this all-important session on mobilizing action for accelerating universal access to safely managed sanitation at the 2022 World Water Week. I'm particularly interested in this session in view of Nigeria's journey towards ending open defecation and ensuring that all citizens have equitable and sustainable access to sanitation. The sanitation situation in Nigeria has been adjudged to be at a critical condition following the WASH Poverty Diagnostic Report on the status of WASH services in the country in 2017. That report was a wake-up call for the country, and it led to many sector initiatives which have consistently demonstrated government's commitment and prioritization of sanitation. A national action plan for the revitalization of the water, sanitation, and hygiene sector was developed, of which sanitation is a standalone component and was launched by President Buhari in November 2018. The vision for sanitation is that every Nigerian will have access to safely managed sanitation and hygiene facilities by 2030, in line with the Sustainable Development Goals target. The presidential launch of the Clean Nigeria Use the Toilet campaign is to drive the national goal of exiting the ladder of countries practicing open defecation and promote sanitation improvement. While we are recording a gradual positive trend in access to sanitation, the case is not the same for safely managed sanitation. The SDG 6 target for safely managed water and sanitation services certainly poses a huge task for many countries like Nigeria, and we are working in collaboration with line ministries, development partners, the private sector, and other stakeholders to ensure that we have appreciable progress in this direction. Nigeria is in the process of a multi-stakeholder review of existing national sanitation-related policies towards aligning them with African sanitation policy guidelines, which provide a framework for safely managed sanitation. The National Open Defecation Free Certification Protocol was also recently revised to include a new criterion that is at least 50% improved toilets for a community to qualify as open defecation free, among other criteria. We're also receiving support under ongoing and new projects that are focused on developing the supply chain and market for sanitation and improve service delivery across the sanitation service chain. UNICEF is supporting capacity building of toilet business owners and the development of a guideline for fecal sludge management, while a grant from the Sanitation and Hygiene Fund will be supporting innovative approaches to fecal sludge management. Also, the Sustainable Urban and Rural Wash Project, being implemented with a World Bank facility of $700 million, has a strong component for fecal management in urban and rural areas. All the elements of an enabling environment for safely managed sanitation, which include political leadership, institutional and legal frameworks, human resources, finance, regulations, data management and regulations, as well as the appropriate strategies and approaches that will be discussed in this session will help highlight issues, strategies, and recommendations that can be taken forward by countries, including Nigeria, in the journey towards universal access to climate resilient and safely managed sanitation for our citizens. I thank you and welcome once again as we look forward to an enriching session today. Thank you.
Thank you so much, Honourable Minister, and it's so inspiring to hear the things that you're leading in the Nigerian context, and including the mention of climate resilience and how you need to also address this in our efforts towards safely managed sanitation. So thank you. So we'll move now to hear from Anne Thomas. She's Senior WASH Advisor in UNICEF New York. She's an environmental engineer with over 2 decades of experience within the UN system and with aid organizations in Latin America, Africa, and Asia. Her passion is driving strategic policy decisions in the WASH sector, and she's served as an advisor to national governments across Africa and Asia, aligning national strategies for water and sanitation with global best practice, looking at climate change considerations, and looking into innovative financing opportunities. So over to you, Anne, to share with us your presentation. Thank you.
Okay, great. Thanks so much, Juliet. And thank you to Gerald. If you could help me with the PowerPoint, you can move to my my cover slide, please. So I just wanted to say another thank you to the Honourable Minister from Nigeria. His presentation really sort of embodies a lot of the shift towards safely managed sanitation that we are thinking about at UNICEF, and large programs like the Nigeria program that are thinking about how to make the shift towards safely managed sanitation are really inspirations for us, and you know, the pleasure that we get in working together with governments that are committed and seizing the challenge of this shift towards safely managed sanitation. So good morning, afternoon, and evening to everyone, and thank you for joining us today. I'll be briefly introducing UNICEF's new game plan for safely managed sanitation as our contribution to global efforts to accelerate action on sanitation. And I'll be focusing on 3 main messages. Firstly, the rationale for the global shift in focus towards safely managed sanitation, some of the key actions that the UN and other partners are engaged in to help provide the needed acceleration, and some of the lessons that we've been building on. Secondly, I'll share the key operating principles for our new game plan and a few of the operational interventions prioritized for UNICEF country offices. So you can stay at this slide, Gerald, that's perfect. And finally, I'll discuss opportunities for partnership, which is a cross-cutting theme, not only in our prioritized actions, but in terms of upcoming initiatives for leveraging strengths and pushing forward as we enter the midterm review period for the SDGs. So why safely managed sanitation? The sector has seen extraordinary gains over the last 2 decades in eliminating open defecation globally, putting us on a very positive trend toward eliminating the practice globally. This is an important milestone toward achievement of SDG 6.2. UNICEF and partners around the world supported the vigorous efforts of governments to set up national programs, strengthening national systems, to focus on the behavioral and social norms challenges associated with open defecations, while stimulating markets to strengthen support to new users of sanitation. The results of this work showed the rates of open defecation decrease, with invaluable lessons on triggering behavior change at community and household level, but also at the political level in order to drive political leadership and system strengthening to support sustainability of these programs. But as a sector, we've also come to realize that while a toilet provides increased privacy, dignity, and security for the user, in environments with poor sanitation or where sanitation systems are neither safely managed nor climate resilient, that we have exposure to fecal pathogens all along the sanitation chain, from contaminated surfaces in unclean toilets or poorly contained pits and septic tanks that leak into open drains and drinking water sources. To achieve health outcomes for children, it has become clear to us that there is an imperative to identify and interrupt all these pathogen pathways by safely managing waste all along the sanitation chain. And it's important that sanitation is recognized as the public good that it is, with government firmly in the lead, because it provides benefits across society in terms of improved health, economic and social development. And in fact, a very recent study by water.org showed 660 million in economic benefit from time savings associated with households accessing safely managed sanitation. But yet what we're seeing is that in many countries, political will and commitment to improving sanitation has been weak, institutional accountability lacking, and we're now trying to shift that narrative. It is now widely understood that the comprehensive package of interventions needed to safely manage sanitation services need to operate within a dynamic system. Strengthening markets, improving policies, providing financing for households to access higher levels of service need to work in tandem to accommodate local contexts. Next slide, please. But change is not happening quickly enough. With only 8 years left until 2030, the rate at which sanitation coverage is increasing will need to quadruple. Sorry, Gerald, just go back one slide, please. If the world is to, thank you, is to achieve the SDG sanitation targets. At the current rate of progress, we will be in the 22nd century before sanitation for all is reality, and clearly this is too slow. So the sector has responded on several fronts. In 2018, the UN High-Level Political Forum recognized Target 6.2 in particular as being off track. And as a result, UN Water developed the Global Acceleration Framework made up of 5 accelerators to support the achievement of SDG 6. Those were around governance, financing, capacity, data, and innovation. And the idea was for partners to coalesce around these pillars, leverage resource to accelerate action. Building on this, WHO and UNICEF published the State of Sanitation in 2019 to increase awareness of the progress and challenges that remained. It essentially reinforced the accelerator framework, providing a call to action for member states, the UN system, and all sanitation sector stakeholders to rise to the challenge, learn from each other, and work together. And while the challenge was significant, it came amid the trials of a global pandemic, an economic recession, and the ongoing climate crisis. History still shows, however, that it is possible. Many countries have made rapid progress, all within one generation. In each case, the common success factor has been strong political leadership to set policy, plan, mobilize investment, regulate services, galvanize widespread participation, and continuously learn and adapt towards achieving safe sanitation for all. And then comes the UNICEF Sanitation Game Plan for safely managed sanitation. Building on the lessons learned, ending open defecation, it covers the 8 years between now and 2030, and the ambition is to help governments to achieve safely managed sanitation for their populations. Through the game plan, UNICEF aims to support 1 billion to gain access to safely managed sanitation in collaboration with its partners. Next slide, please. The approach in the game plan to reach safely managed sanitation is guided by 6 key principles. The first is to think big and work at scale, to be selective about engaging in transformative support to government, and to support comprehensive solutions through government-led approaches such as area-wide sanitation, city-wide inclusive sanitation. The second is around equity and inclusion. We'd like to build on the work that we were doing with the game plan to end open defecation, to champion sanitation solutions for everyone, including support to government to design smart, sustainable subsidies where needed, and address the disproportionate impact of poor sanitation on women and girls. We will look for resilient, green, sustainable solutions, thinking of sanitation as part of a circular economy, promoting solutions that are climate resilient. We will also work across humanitarian and development contexts, leveraging UNICEF's unique position in working across both emergency and long-term development solutions. And we will work with all stakeholders, both in the UN system, but also civil society, donors, development banks, NGOs, academia, and the private sector. In particular, using our convening power to bring sector stakeholders together across ministries and across all levels of government to encourage mutual accountability. And we will choose interventions consistent with UNICEF's comparative advantage, looking to partners for complementary interventions. And I think this last principle is really at the heart of our new approach, looking at how we work effectively with others and pick the interventions that are truly in line with our comparative advantage. Next slide, please. So the game plan is aligned to the 5 accelerators that I spoke about earlier. And at the global level, one of our metrics for success for the game plan will be our ability to catalyze discussions with governments such that they are able to fully understand not only the definitions of safely managed sanitation and to contextualize them, but also to understand the implications in terms of cost, policy, and governance that the shift requires. And from there to be able to develop meaningful national action plans and targets for the progressive achievement of safely managed sanitation services. Ideally, these action plans that we're holding ourselves accountable to in many ways will articulate key national priorities and consider strategic pathways for UNICEF and other development partners to support government action and identify pathways to help orient programs toward the full ambition of SDG 6.2. So here I just wanted to call out a few of the foundational interventions which will be the focus in supporting countries in this move toward the full ambition of the SDGs. So let me start with data and information, which for us, we consider our low-hanging fruit, given the work that we are habitually engaged with the JMP and supporting strengthening of monitoring in the sector, recognizing currently the gap in countries reporting on safely managed sanitation. This will build on some of the lessons and work of the SMOS program, for example, that focused on safely managed on-site sanitation solutions and how to strengthen national data systems, performance tracking, so that they serve both national programs and global reporting purposes. We will help to build sector-wide capacity under the capacity pillar with a focus on our government counterparts in terms of non-sewered sanitation options, on-site sanitation, and in understanding the mechanisms that can support at-scale programming and policy. Under the governance and policy pillar, stimulating political leadership through high-level advocacy and dialogue, and strengthening institutional accountabilities for sanitation through such approaches as the WASHBAT and joint sector reviews will be an important aspect of our work. Recognizing the fact that a majority of countries where we work do not have lead ministries for sanitation, adequate budgets or policies that can cover attainment of universal coverage. An example of this kind of work is found in our partnership with the African Ministers' Council on Water, who we'll hear from later in this session, on the rollout of the African Sanitation Policy Guidelines across the continent and supporting strengthened national sanitation governance structures aligned with SDG 6.2. When it comes to financing, we're prioritizing working with governments to support financial strategies to achieve safely managed sanitation. And perhaps our strength there will be in supporting household financing mechanisms, recognizing households as the primary funders of sanitation in low and middle income countries, and relatedly support for development of smart subsidies, tariff design, or microcrediting programs, leveraging those investments. And we will look in this regard to partnership with DFIs to help complement and support large-scale investments. And we'll be hearing from one of our partners, the World Bank, and how they have been working on this challenge. Finally, we've been working to strengthen the enabling environment for product and service innovations in several markets, using market assessments as an initial lens through which to understand the complexity of markets, gaps in services, regulations, and policies, and where UNICEF can come in meaningfully to support governments and private sector to strengthen engagement in the sector. Our partnership with Lixil, who is also here today, was born of such an exercise and continues to evolve to meet evolving needs for safely managed sanitation products and services. Next slide, please. With the countdown to 2030, there are key moments ahead to strengthen government leadership, increase political prioritization, and encourage strategic public investment in sanitation. The first is World Toilet Day coming up on November 19th, which will echo this call to action and the countdown to 2030, raising the profile of sanitation as the most off-track SDG and the most underfunded to date. Another key advocacy moment will be the SDG midterm review next year, officially known as the UN 2023 Water Conference, co-hosted by the governments of Tajikistan and the Netherlands. During this event, commitments for action to further accelerate progress will be heard, and an opportunity for the global community to come forward with their own commitments and to support government commitments to accelerate progress. My hope is that today, through the various presentation of all the work afoot in the sector, that meaningful connections can be made and that we can all find a way to work together toward this ambitious push toward 2030. So in summary, I've discussed the global shift toward safely managed sanitation, why it's so hugely important to health, dignity, and socioeconomic outcomes. I've shared some of the framing principles of UNICEF's new strategy to support safely managed sanitation and our vision for working with governments and in partnership with key sector players. And finally, I've highlighted the urgency to help accelerate action before 2030 and the opportunity of the midterm review next year to redouble efforts and work together to support governments in the final leg of the SDG era. We're honored in this session today to have key sanitation stakeholders from government, from the private sector, academia, and the UN to share their contributions to the global push to 2030. We all have a role to play in accelerating progress toward universal safe sanitation. We hope this session will inspire you to consider how to support countries in their shift to safely managed sanitation so that finally the ambition of safe sanitation for everyone, everywhere is achieved. Thank you very much, and back to you, Juliet.
Great. Thank you, Anne, for sharing that and sharing the broader ideas around how to accelerate progress and the idea of those 5 dimensions of governance, capacity, financing, data, and innovation. And hopefully, I think those will provide a thread for us through this session. So we're just checking if participants would like to ask a brief question or two to our Honourable Minister or to Anne Thomas. We'd welcome your questions. And so we'll just give a moment. If there is a participant who would like to directly ask, please use the chat on Pathable. And otherwise, I might just jump in if that's okay. And I have a question for our Honourable Minister, because I guess, it's unusual for a country to have very high level political support for sanitation, and yet we know that's so critical. And I'm interested, what advice would you have to people working in other countries about how to secure that kind of high level political support?
Wow, tough one. I think first of all, you need to lay out the case very well. In our case, like the diagnostic report, the poverty diagnostic report that we had, gave all the dismal statistics, which we made available to the president and to the state governors and to relevant ministers, and the evidence was there for everybody to see. So I think that that helped a lot. And then, of course, we're also determined that look, we have lots of things competing for budget, but I think issue of sanitation, whereby it's everybody's business and it's something that you can send the message directly to the people, and the bulk of it should obviously be deployed by the citizens themselves. I think it was something that I thought was doable, and therefore all we need to do is spend a lot of money on advocacy and giving the right tools and training. So we could achieve a lot of mileage with less compared to infrastructure projects that we're doing for water supply, for instance. And therefore, that also gave us the impetus to really give the sanitation sector or subsector a hard look. And also maybe the fact that we felt that it's something that is a must do. I think also the fact that where we are up the ladder relative to the rest of the world was also there. So evidence, the evidence is there, and I think. And that's why we were able, again, with the support of UNICEF, we've launched our national outline routine mapping for WASH for the past 3 years. We only had a gap where during the COVID lockdown. So because we realized that the evidence can be, if we have all the, the data, then that just can give us the wake-up call that we did. We call that WASH diagnostic report of 2017 a wake-up call. That's what we called it. And we've been awake since then, and we're trying to do what we can. But I also really appreciate the fact that President Buhari gave a lot of support to it, including declaration of a state of emergency on the wash sector, so that you could encourage. We have a federal system, just we also to encourage the states to do the needful, and he did that along with the launch of the wash action plan. So I think those are some of the key things that really helped us, and we're determined and committed to forge ahead.
Fantastic, thank you. It's very inspiring, and we just hope we can replicate it in other places. Thank you. So just a very brief question to you, and that's, I guess, what do you see as really the biggest challenges to overcome if we're to achieve safely managed sanitation?
Or not me, sorry. Okay.
No, we're always happy to hear from you, Honourable Minister. So please go ahead if you'd like to jump in.
Yeah, if you'd like to jump in, please feel free.
Okay, I actually thought the question was for me, but let me say that for me, two things. Number one, our peculiarities. We have a federal structure. We have 36 states and the Federal Capital Territory, and getting all of them to work in the same direction with the same, there are different governments, sometimes different political parties, different priorities. But if we're trying to get them all to take this as a priority is a big deal. Secondly, I think issue of technology. I think we need to really take appropriate technology, not taking expensive solutions or untested solutions. So we can have systems that are affordable and adaptable. The people can easily adapt to those situations. I think that will work fine. So sorry, Anne. What to you?
That's okay. You're very concise, and thank you. So, Anne, do you want to give a brief response, and then we will move on?
Sure. I think there are two things that I wanted to highlight, and I think Nigeria again is sort of exceptional in the amount of political leadership that we've seen guiding the programs. But I think globally we still have a huge gap in terms of political leadership and championing of sanitation. And it's where we see strong political leadership that we have the greatest results and really the biggest gain in terms of the sanitation sector. So I think political leadership is really sort of the paramount issue right now, and how we foster greater championing of the sector. I think the second one that I wanted to highlight is the capacity gap. I think globally we're talking about safely managed sanitation and in very specific definitions of what we mean by that, but I think we're not always great at marrying that dialogue with what's happening at country level. And so at times there is a capacity gap in terms of understanding the various options for achieving safely managed sanitation, the fundamental definitions that we carry as a global community on safely managed sanitation. So how we broker those discussions with government, make it meaningful in a local context and serving local priorities and programs, and then working to support governments to build their own capacity to answer the challenge, because there is no right answers at the moment for the sanitation sectors. And in many ways, a lot of the work we are doing in many countries is pioneering new solutions for the challenge of non-sewered sanitation. So I think this requires capacity building, not only within our sector, but helping our government counterparts as well to move along and to lead progress at a country level. So I think I'll end there. Thanks very much, Juliet.
Thank you, Anne. So got several special ingredients there across our two speakers of the political leadership, making it everyone's business, and addressing the capacity gap. So thank you so much, Honourable Minister and Anne. And from here, we will move on to our panel discussion. So I'd like to introduce our 5 panelists, and if you could each switch your videos on as I will introduce all 5 of you, and then we'll move to a question for each of you. So firstly, we have Dr. Azika Tanko Yusuf, who is the Acting Director of Program in the African Ministers' Council on Water, AMCOW.
Thank you. Happy to be here. Thank you.
And he is a policy program specialist over 17 years, policy advocacy, influencing, capacity building, and knowledge management on wash and water resources across sub-Saharan Africa. He has extensive experience leading policy dialogues, providing platforms for citizen government engagements for more and better wash investments. And he holds a PhD in migration studies. So a warm welcome, Dr. Azika. Secondly, we have Mr. Tano Zisochi Laze, who is the Director of Sanitation in the Ministry of Public Works and Housing in Indonesia. And he has extensive experience in areas of sanitation and holds a master's degree in urban environment management. So a warm welcome to you also.
Yes, thank you, Juliet.
You're welcome. Nice to see you again. So then from Nepal, we have Dr. Rajit Ojha, who is the section chief in the Department of Water Supply and Sewerage Management. And he's leading a unit called the Institutional Support and Service Advisory Unit, and also the National Management of Information Project, which you'll hear a bit more about later. He's also the chief and national director of the National Water Supply and Sanitation Training Center, and holds a PhD in water governance. So warm welcome to you, Dr. Ojha.
Hi, namaste everyone. Good afternoon. Nice to meet you.
Then we have Erin McCusker, who is Senior Vice President and Leader of Sato and Lixil Public Partners at Lixil. So Erin leads businesses and initiatives across Lixil to deliver on Lixil's purpose of making better homes a reality for everyone and everywhere. And Sato is their award-winning flagship social business. And Erin is orienting that business for its next phase of growth to drive Lixil's ambitious goal to improve the lives of 100 million people by 2025. So welcome, Erin.
Thank
you. Welcome. So last but not least, we have Miguel Vargas Ramirez, who is the lead for Global Citywide Inclusive Sanitation at the World Bank. And he's a Colombian civil engineer with 22 years of wash sector experience in the World Bank and other institutions. He's worked in Bolivia and Panama, expanding sewage services for the urban poor. And he also has extensive experience working in Africa with a focus on national and state governments and water utilities. So as you can see, we have a fantastically experienced panel here to share with us your thoughts on accelerating progress to safely managed sanitation. And so we might start with Dr. Azika from ANCAO, if that is okay. And we have a question for you, which builds on the successful launch and ongoing rollout of the African Sanitation Policy Guidelines. And based on your experience so far, how do you think this kind of regional initiative can accelerate progress on safely managed sanitation? And how do you see AMCAO as influencing the political landscape in the different African countries to prioritize safely managed sanitation? So over to you, Dr. Azika.
Okay, thanks so much. I hope I can be heard loud and clear.
Yes, all good.
Yeah, okay.
Thank
Thanks
you.
so much. And then let me first express our warm greetings to Honorable Suleiman Adamu, our Honorable Federal Minister for Water Resources. In fact, he is the AMCAO Vice President for West Africa. So leading our water and sanitation efforts across the West Africa sub-region. Yeah, well, as you have already highlighted, 2 years ago, 2021, all efforts, all hands were put on decks for the development of the Africa Sanitation Policy Guidelines. Since then, a number of countries have actually expressed interest in the use of utilization and domestication of the guidelines. As we speak now, we have made effort in about 13 countries now, of course, with the support of UNICEF and the likes for the adoption and utilization of the ASPG. These countries, as we speak, are at various levels of utilizing the ASPG. In fact, some of them have already done the baseline assessment. Some of them have already have the draft policies that we are having in the continent. And more importantly, also, we have some of the partners also strongly supporting this. And then I have to underscore that currently we are in the stage of what we call the ASPGs in action. With the ASPGs in action, we are trying to ensure that safely managed sanitation is highly prioritized at the highest level by the ministers and also by the heads of states and government. Within this framework too, we are driving efforts at having a coordinated united front with member states and with also partners like UNICEF, with Water Aid and the likes, so that all hands are put on deck for us to accelerate action on this. And then you will have agreed with me that all the effort that we are doing, knowledge brokerage, learning, and knowledge management is very central at this stage that we are currently in, because we don't need to repeat the mistakes of the past in accelerating action on safely managed sanitation. So knowledge brokerage, learning, and of course, this is also very important for decision making. And more importantly, also improving the water wisdom of the continent and beyond is the vision of the Africa Water, 2025, Africa Water Vision 2025. So we need to improve what we are doing. So by doing this, we'll be able to learn and in order not to repeat the mistakes of the past. Another important area that I want to underscore under these ASPGs in action is also making sure that in the end, the development partners that are supporting our work across the continent are having a coordinated front. So we have initiated under this action, the Development Partners Coordination Framework, which will bring together all the development partners, USAID, CIDA, World Bank, all the development partners across the sector, so that we can track how we are doing. As of now, if you access how much are we pumping into the sector, especially on safely managed sanitation, I may not be able to tell you. But with this coordinated framework, we'll be able to see how effectively we are using the resources that are coming into the sector, and then the gaps that are there to be filled. And then more important, to actually know whether is it a problem of inadequate resources or it's a problem of ineffective utilization of even the little resources that we are having. So those are some of the key building blocks within which we are trying to anchor safely managed sanitation across the continent and even beyond. At this moment, I will leave it at that point so that if there are some few questions that emerges, we will take it from there. Thank you.
Great, thank you, Dr. Azika. And yeah, point well made about the need for learning and knowledge brokerage, and for that it's not just about more resources, but more effective use of resources. So thank you for your points. And we'll move on then to hear from Mr. Laze from Indonesia. So Indonesia has made great progress in mobilizing action at both national and subnational levels towards safely managed sanitations for its population. And we're keen to hear about your country's experience on how you've mobilized leadership and governance at both of those levels in accelerating progress. And what do you see as transformative actions that require for strengthening institutional accountability and coordination, given that in Indonesia we have so many different ministries and departments and agencies responsible for sanitation. So Mr. Laze, please go ahead.
Yes. So thank you, Juliet. Well, I will share in Indonesian experience how to accelerate the universal access. And the first milestone is start with the policy and regulation. There was a decree of Minister for Health regarding the national strategy on community-based total sanitation in 2008, and followed by President regulation in 2014 regarding accelerating water supply and sanitation development. And also my Ministry of Public Works issued regulation regarding domestic waste water management. And after that, the National Board of Planning initiate a working group at national level, and then followed by planning agency at provincial level as well as the municipal level to develop a citywide sanitation strategy. So the central government give assistance to the provincial level, and also the municipal level to develop the citywide sanitation strategy, and then promoting a community-based sanitation approach. In case of how to increase local political awareness, we conduct national forum conference to promote how to handle the what's called community sanitation. And of course, after that, some municipal maybe becomes like champions. They want to express his ability how to manage sanitation. And one best practice in public service, I think, from East Java, one municipal promoted implementation of regular deslating services using what's called by application in handphone. So everyone can ask to deslating their septic tank and in routine. So I think this is one practice that can give other municipal will be want to follow the success. I think something like that today.
Great, thank you. And yeah, fantastic to hear about the range of different regulations and the legal backing that the sector has had, as you described, and also the various programs such as the desludging program and community-based sanitation. So thank you very much, Mr. Lade.
You're right.
So we'll move on then to hear from Dr. Rajit from Nepal. And here we're going to shift to a focus on data and information systems, which was one of the themes that Anne brought up earlier. So we all know that having robust and effective data systems are really a critical part for being able to plan well, for policy development and for decision making. And we're keen to hear about how you've done this in Nepal to support planning with evidence-based investment for safely managed sanitation. And further, how has your country's data system supported monitoring on SDG 6.2 on safely managed sanitation? So Dr. Rajat, if you could share with us.
Thank you, Juliet, for the question. Thank you for the opportunity again. Good afternoon, everyone. So what we did 4 years ago was we started from rural water supply monitoring and evaluation system, but later on we realized that it should be somehow linked with both SDG 6.1 and 6.2, and then it should be localized because we have like more than 700 local governments, 753 local governments, and it should be localized because the local governments have the data providers. So what we did was, and without any incentives, local government will not be willing to put the data there. So we identified the database management system should go beyond the database management system. It should be something like decision support system for the local governments, where they should identify the investment required to achieve SDGs 6.1 and 6.2. So based on that, what we did was we started the overall idea of this database management system, where the local governments collects the data from mobile applications. The data are geo-referenced in household level sanitation and household level water supply both. So based on that, the tentative investment to reach the SDGs are calculated, which comes in the package of WASH plan, where you can calculate how much investment will be required inside sanitation also. And based on that, what the local government can do is they can identify the investment options, such as, let's say, how much they are willing to put under the tax, how much they are willing to create from the tariff, and whether they want to go in terms of trade or they want the transfer, and this kind of things we can divide there. So if you aggregate all those data, you will get the overall national data profile where you will know how much investment will be required to achieve safely managed sanitation services. So while we're doing that management information system, we also identified that the JMP's indicators, we took the JMP's indicator to do this. JMP's indicator might not be enough, because you need to go beyond GMP to assess the functionality of the assets. So right now, it's not in the system yet, but what we are planning is we're planning to aid the asset inventory of all the sanitation utilities that are doing the work, and also performance-based benchmarking to assess their efficiency. We have already done that in water supply schemes. So what we want to do is we want to use the same model and same replication in sanitation services as well, to assess the whole sanitation service chain. So we know there are a few gaps inside MIS still, but we're willing to improve on it. Thank you.
Fantastic, thank you. And yeah, I hadn't realized it was such an elaborate tool for helping plan investment. So thanks for sharing those details about how the tool can be used for decision support. So we might move on to another panel member at this point. So Erin, we'd like to invite you to speak a bit more about Lixil's work. And so we know that Lixil is involved in innovative sanitation and hygiene solutions globally. And based on your experience, how would you see the role of the private sector in helping achieve the really ambitious targets of universal access to safely managed sanitation? And we'd be keen for you to speak a bit about key elements for effective collaboration between the public and the private sector in promoting safely managed sanitation. So over to you.
Thank you, Juliet, and thank you to all those speakers and the panelists. I think it's really important to have such a diverse representation of the different stakeholders and partners that it takes and will take for us to accelerate progress. So if I can provide just a little bit of our experience from the private sector with Lixil and with Sato, particularly over the last 10 years, we've really focused on making affordable solutions. And I think the point that was made about technology and the need for more innovation in the toolkit that we have is a really important one. Currently, we've reached about 35 million people over the last 10 years, with about 6.5 million of our products being shipped to about 44 countries. And I think in this area, we've really started to hone in on a couple aspects of Sato and our business model that we think other private sector companies could learn from to be a partner in this goal. So one is the innovation, and I think this has already been touched on, but we really do need innovation to fill gaps in the current product offerings. And this is particularly for the parts of the community that are most at need of accelerating that progress, even in achieving kind of access to toilets and ending open defecation. But as we try to leapfrog or think ahead to this shift to safely managed sanitation, we feel that this innovation and really thinking about a whole package of solutions that meet the needs of these households and these communities is really important. So we as Sato have invested in our innovation team, which if you're attending in person, we'll actually have our whole suite and package of solutions available for display. But this innovation is really important to make sure that we're getting the feedback from the consumers. So things like the market assessments from UNICEF, some of the data that was just shared by our colleague in Nepal, even the campaigns that are raising awareness, we're really seeking out where are those current gaps in the tools for consumers. What's the feedback from the consumers on their experience using the product? The entrepreneurs, the toilet business owners, for example, in Nigeria. How do we kind of represent all of that, or gather in all of that feedback and make sure that we're using that to drive our innovation, to improve solutions, and to locally tailor them? So that's something that Sato in particular has found a role for the private sector to play in this challenge. I think one key aspect there to share as well is our collaboration with UNICEF during the pandemic. So we had identified the need for a low-cost hand washing station that could encourage hand washing with soap during this public health crisis. And we were able to partner with UNICEF to get rapid feedback on the design and the need for the design, but also then to rapidly test in communities at need. And that iteration really did lead to some small improvements before we went to a mass production and scale. So I think this idea of innovation, using all of the different partners that we have to get feedback in designing the products and services and getting them out to markets is really critical. I think on the supply side, we have innovations, but we also have the supply chain networks themselves. So for us, this is another key area where I think over the last 10 years, SATO has really seen investment required by the private sector. And that's coming in a couple different areas. One is localizing to our markets. So we're looking at a national or regional level to invest in the capacity of our manufacturing partners. So these are businesses that may already have distribution networks or may even have a sanitation or plumbing focus. But how do we expand the toolkit that expands their potential for business? And therefore, there's a desire to invest, to reach into more markets and create sustainable supply chains. I think that's a key piece for us in terms of investing to ensure that these products are going to be available not just one time, but they're going to be available over an extended period of time. And that entrepreneurs such as the toilet business owners, or we have our SATO entrepreneurs as well, they're able to really have a reliable supply for building their business and growing their own business within the region. When we are looking about our supply networks, we're really also looking at how other actors are coming in. And so for us, I think the emphasis the Honorable Minister put on the moving all in the same direction, also our colleague from ANCAL about taking a coordinated approach. We have seen in particular that when we are more aware of the goals and priorities of the government, when we're more aware and engaged in the conversations about where the true needs are or how gaps need to be filled, where financing may be an issue, we're able to then come together with other partners to tackle this solution. One great example of this is in Kitui County in rural Kenya, where we had established our business, but then in expanded partnership with UNICEF through our Make a Splash partnership, we've been able to actually go from very minimal to no coverage of non-sewered sanitation solutions to over 90% coverage in 5 years. And so this was an example about working with the local government, bringing in the supply, doing the capacity building. And I think what we're looking to do is then replicate what works. So I think just very briefly, for others who are looking to get into this space, and I think to all of our colleagues on this call, the private sector really wants a seat at this table. We want to be able to come in, we want to understand where there may be gaps in innovation, where there may be opportunities on the supply chain side. And I think when we get into the service of safely managed sanitation, there's even a wider set of actors who are looking to get involved. So, I encourage you as you're developing these coordination forums, or if you're thinking about these input panels or the market assessments, to really tap into the private sector players and the actors at a global and regional level who want to engage. And I think the second piece is that it's really important that we get two-way feedback, knowledge of where these priorities might be coming in, where are there gaps in innovations, where is there expected demand at scale, which can greatly de-risk a private sector's entry, players' entry into a new market. And so we really are trying to focus on private sector's role in the room, but also I think how we can create more of a two-way dialogue and make sure that this feedback on what it will take for us to accelerate is really reaching each of the different actors. So we look forward to participating in these conversations with each of you more. And I think that collectively then we'll be able to accelerate the progress as we aim. Thank you, Juliet.
Great. Thank you so much, Erin, and wonderful to hear both about the technological innovation that we can access through the private sector and that alignment of goals. I think of all moving in the same direction. That's one of the biggest things that can change the status quo, I think, in the sector. So thank you. So we'll move to our last panelist, Miguel, at this point, and we're going to ask him to speak to one of the other areas that Anne spoke about, which is financing. And so obviously it's a major pillar for accelerating progress, and the World Bank is one of the largest external financiers of water investments globally. And so, Miguel, what investment opportunities do you think that we have to accelerate progress on safely managed sanitation? And indeed, what do we need to put in place so that we can actually attract these and other investments for sanitation? Over to you.
Thank you, Juliet. No, I think this is Anne put the challenge very clear at the beginning. I mean, the investment needs are huge. Actually, there's a couple of years a study about the need for WASH investments, about 114.2 billion per year. The World Bank being the largest finance, we only finance 3.4 million. So you can realize the big gap of financing. And so that's why we have developed for external financing more aggressive mechanisms for financing that they're trying to aim to have a big and scale. And one of these is the P4R. And one of the prime examples of the P4R for sanitation is precisely the one mentioned for the Honorable Minister in Nigeria, the Soil Wash project for 700 million investments in sanitation and water. So along this P4R, the idea is that we don't, P4R is program for results. We don't concentrate in the inputs. We don't concentrate on the pipes and the cement, but rather on the service. And along this, there's a lot of incentives for the service provider to actually provide sustainable connections. And another variation of the instrument is called the multi-programmatic phase approach, multi-phase programmatic approach. We call it the MPA when we realize that sanitation transformation is not going to happen in 4 years of a project, 3 years of a project, but rather it requires 10 years to transform the whole sector. So this multi-phase programmatic approach allows you to have a clear goal at the end and have financing by tranches. However, the financing is very important in the infrastructure, is very important, but we also like to emphasize the part of working on policy, institutions, and regulations, particularly because it's important to understand who is responsible for sanitation, what are the monitoring and evaluation systems that Rajit talked about, what is the governance environment where this investment take place. So that's why we partner also with AMCA, with the SPGs, and we understand that the policy guidelines is an important part of the financing puzzle, in a way that the better the data and the better the policy, the more clear structure, the more financing can be attracted. Private sector, for example, likes an environment on the rules and regulations are clear, and there's transparent transaction, there's regulation. So getting that part of the puzzle in terms of the policy, investment, and regulation is critical to crowd in additional financing besides external financing. I think I also want to mention 2 additional factors that influence the financing. I mean, you can pour more water into the system, if you allow me the analogy, but you also have to control for the leakages. So I think that effective expenditure is one of the important aspects. Many of that we realize many of the budgets allocated for some of the ministers are not fully utilized. In cases like in Peru and Latin America, we have this public expenditure review, and in some cases, this actual expenditure reaches 60–80% of what's been allocated. So there's a big portion of the funds that are available for investment, but unfortunately are not used. So this is an important part of solving the financing. And the other one, of course, it was mentioned already by Erin and the minister, the honorable minister. It was technology, not only the appropriate technology, but how we can unleash the power of technology, for example, to be able to provide better team of on-site sanitation and tracking the service provision. That's something that, 15–20 years ago, it was extremely expensive. But now with technology, there's all these issues of provision of services, the connecting people that don't have services to the service providers, are much more easier. And then I think as we move along to the scale, this technology will become cheaper and cheaper. Finally, let me mention, and I think what I consider one of the untapped sources of financing for sanitation, which is the climate financing. As you know, in the sanitation change, we have direct and indirect emission of methane, nitrate oxide, and CO2 that can be captured or can be avoided, according to the technology, to claim some resources for climate financing. Currently, water and sanitation for climate financing only represent about 2% of the total green of the total climate finance. So it's imperative that we understand much better the relationship between sanitation and the choices and the trade-offs that we have to do in terms of adaptation and mitigation when we choose a technology, when we choose a particular solution at a large scale, and to be able to couple that with strong arguments to claim climate financing. Unfortunately, what we've seen is very few countries have sanitation and even water, Washington in general, into their national adaptation plans. They're not part of the national determined contributions. So I think there's a big effort that we need to do in order to be able to incorporate that understanding of sanitation as an important piece of the climate financing, and consequently claim some resources for the sector. So I think we have a lot of challenges and a big investment to do, but I think the instruments and the tools and ideas are there. So I'm very optimistic that we can overcome this challenge. Thank you.
Great. Thank you so much, Miguel. Very helpful inputs on several different angles to do with financing, making sure we have the right incentives in place, thinking about the multi-phase, just how long sanitation investments really take, the use of budgets, climate financing, many different ideas for people to think about how to accelerate progress. So we just have a few minutes left of our panel members here, and I know we do have a couple of questions in the chat, but if it's possible, I was thinking it would be nice to hear just one statement, one takeaway from each of you, that if you could only do one thing, and you're only allowed a sentence or maybe 2 sentences, if you could just do one thing to accelerate progress further in the country where you work or countries where you work, what would that be? And please just maybe raise your hand if you're ready to answer. One thing only. Okay, Reggie, please go first.
So I just wanted to highlight that the important thing inside MIS is peer-to-peer learning, where one country can learn from another country, because we don't have to reinvent the wheel again while we're making the MIS. Governance assessment is extremely critical to assure accountability regulation. And I think the more open the data is, the more beneficial it will be, especially for if we can collaborate with the private sector and research and academia. It will give us the government can leverage the overall benefits. I think these are the key points from my side. Thank you.
Great, thank you. I think you slipped in at least 3 things, but I think they're all very important. Dr. Azika, what's your one thing?
Yes, thanks so much.
One sentence only. See if anyone can contain themselves.
Thanks so much. I think we've seen that high-level political support for policy strengthening, works. I mean, our honorable minister even alluded to that. The case of Nigeria is clear. The case of India is quite clear. And just to see one thing, knowledge management, knowledge brokering is very important. I rest my case.
Okay, thank you. You managed to slip in 2. Well done. Thank you. Erin, please go ahead.
Thank you. I think for me, in the spirit of moving in the same direction in coordination, I think how we can start to aggregate demand and get some of the reach and economies of scale, whether through kind of a focal point or other mechanisms, but this really can play a role, I think, in concentrating our efforts and having a bigger impact.
Great, thank you. So, Mr. Laze, would you be
Yes.
happy to share? Thank you.
I think it's similar. We should focus on demand creation and financial creativity to accelerate this universal access. That's the key point.
Thank you. Yes, absolutely agree. Thank you. And Miguel, please go ahead.
Yeah, I think from my perspective, the key aspect is harmonization across the different development finance institutions. I mean, we focus on the country systems, on the policy and guidelines that they have, and everybody contribute to the same thing. We avoid a lot of transaction, a lot of input-based support, and we concentrate on the outputs and the results. So harmonization across different multilaterals.
Great, thank you so much. So I think if we can do all the things that our 5 speakers have suggested, we'll go a long way to accelerating progress. So we'd like to thank you so much for your inputs. I was going to say this evening or this morning, whatever time it is of day for you. It's very much appreciated that you were able to join us and share with us your experiences. And from here, we will move to the closing part of our session. So thank you so much. And I'd like to then introduce to you Kate Medlicott. Kate is Sanitation and Waste Team Leader at the World Health Organization. And in this role, she's responsible for translating evidence to policy and practice. And that's done through WHO guidelines on things like sanitation and health, on safe use of wastewater, recreational water quality, and other tools such as sanitation, safety planning, and sanitary inspections. She also leads health sector collaborations where sanitation is a critical component of risk and disease control, such as with regards to antimicrobial resistance, neglected tropical diseases, and environmental surveillance on COVID. So over to you, Kate, to see if you can draw together some threads for us from the many different inputs and inspirational ideas we've heard so far.
Thanks, Juliet. Sorry, I would have given you the shorter bio if I'd known it was going to be read out. I guess I think that was just such an incredibly rich session. I can't capture everything, but I think just sort of taking us back to the start, I think what was really clear is that, you know, from the State of the World Sanitation Report and all of the data coming from JMP and GLASS, it's clear that, you know, we're really off track. We need to quadruple progress. So business as usual is not an option. We have to embrace this acceleration agenda. And also just to remind that, you know, all the health evidence we have shows that moving to safely managed sanitation is not kind of arbitrarily raising the bar and making our job harder. We really need to be interrupting transmission so that we get the health impact out of sanitation investments that we would anticipate. So that means not just ending open defecation, but thinking about getting to minimum service levels that really interrupt transmission, and also not leaving the job really in the hands of households, kind of understanding that we have to be moving towards professionally managed and regulated services, which entails a much bigger role for government. And we've seen a lot in the partners here talking about the need for that investment and system strengthening in addition to facilities and services, and making sure those are supported by standards, quality assurance, subsidies, capacity development, and enabling the private sector. So we talked a lot about these 5 accelerators, and I'd encourage you to sort of revisit those and think about those as you put together your own acceleration agenda. But just some things that stuck with me from some of our participants, firstly from the Honourable Minister from Nigeria. I mean, it was really clear this strong political commitment is so important, and using that evidence for this, you know, wake-up call. Wonderful to see there that they're going beyond ending open defecation in Nigeria and moving towards kind of minimum standards and improved services. UNICEF with their new game plan, it's really clear that institutionally UNICEF is really embracing the safely managed sanitation agenda, with looking at a comprehensive package of interventions and really putting government firmly in the lead. We discussed some of these challenges, the challenges of gaining that political leadership and multi-sectoral coordination, and also challenges of technologies, but not just adaptable technologies, but the services that accompany them. And also the capacity gaps, really making sure as a sector we understand the definitions, the technologies, the pathways to safely managed sanitation. From AMCAR, we heard some great regional initiatives looking how we can really accelerate using regional initiatives like the ASPG in action for capacity development, knowledge management, and also coordination of development partners. In Indonesia, we saw the real embracing of the citywide inclusive sanitation agenda, particularly through new regulations and laws, but also some strengthening at the local municipal level as well. Nepal gave us a wonderful example of data management systems. So making use of modern technology and going beyond the JMP definitions and into making sure that data really supports local decision making. From Lexel Sato, we heard that the private sector is ready and waiting. They want a seat at the table, and they're really leading the way, showing us how to have a customer focus to drive innovation of technology and services, and also working on sustainable supply chains and business models for entrepreneurs. For the World Bank, yes, we acknowledge this huge investment that's needed, but also knowing that that's going to be ultimately cost effective when we look at the huge positive externalities of investment in sanitation, really approaching this really aggressive financing for the P4R program, and moving from not just incentivizing infrastructure, but incentivizing services, and also investing in the system strengthening that will crowd in more investment into the sector. So that's fantastic. And then from everybody, a really important thread I think I picked up there was recognizing that we can't afford to have these important investments kind of lost. So lost through not fully utilizing those investments, or lost through missing the opportunity of incorporating climate resilience or the circular economy. So yeah, I'll stop there, and I just wanted to really pivot then to what's next and remind you all that we're actually just coming up to halfway through the SDGs. So World Toilet Day is coming up, the UN 2023 conference is coming up, and we're going to be launching a countdown to 2030. So making sure that we're gathering these commitments into the 2030 action agenda, and then making sure those commitments become a reality. So we will be working as a collective and to make sure that we communicate with you more about how you can contribute to this action agenda. But firstly, I would say keep an eye out on World Toilet Day for the countdown and the countdown graphics that you can use in all of your work, and also the UN 2023 conference website where you can see how you can engage and contribute in that action agenda. So with that, I think we're ready to close the session. So thank you to all of our contributors and partners. Juliet, did you want to have a last word for the close?
Thanks, Kate. Yeah, maybe just to say, I really hope all our participants in this session have found something you could take away that you feel is something you can do in your role. I think for me, another theme was about alignment of us all behind this common cause. And so I hope there was so many different possibilities of what you could take away to do. And you need to choose the thing that's relevant to your job and your role. So thanks again to all our panel members. Thanks, Anne. Thanks to our Honourable Minister. Adamu, nice to see you. I don't know if did you want to say something brief? We have one minute. No? Okay, well, thank you so much for staying with us through the session, and enjoy the rest of the online Stockholm, and for those of you who will be there in person next week. Thanks all.
Okay, regards to colleagues.
Thank you very much.
Thank you.
Bye.
Thank you all.
Thank you.
Bye.
Thank you. Ciao.